Hello, my friend. This is part 2 of what is up with plastic surgeons these days. And I'm laughing because I'm half kidding, maybe more than half kidding, but really we are continuing the saga. What is up with plastic surgeons? This new ongoing trend where they are bashing, talking smack, etc. about less invasive treatments for treating the aging face, non-surgical treatments like fillers, biostimulators, and tightening devices like radiofrequency, ultrasound, and telling people that they should just completely avoid those procedures and they are completely useless and very harmful and nobody should do them ever and you should just get a facelift. So if you have ever dealt with sagging of any form, whether it's in the jawline, the kind of waviness that you get to the jawline, the jowls right here, or deep folds around the mouth and the chin, marionette lines, etc., if you have dealt with that, this is going to be super pertinent to you because you really want to know, okay, is a facelift really my only option? Are these plastic surgeons right? Should I just avoid all those treatments altogether? Are they really that harmful? And if so, should I just save up money for a plastic surgery? Should I get a facelift? Should I wait another 10 years and just deal with the sagging until then and really hate what I look like in the mirror and just deal with it until I can afford a facelift, etc.? So that is what we're going to talk about today. Now, in the last video, I went over fillers and biostimulators and why plastic surgeons are getting it totally wrong when it comes to those treatments. I will link to that video in the description below. And today we're going to talk about the tightening devices like ultrasound-based devices, radiofrequency-based devices, whether it's straight up radiofrequency or radiofrequency microneedling, okay? And what is the deal with these procedures? Are they really that harmful? Do they make you look older like the plastic surgeons are saying? And again, I will reiterate, it is not every plastic surgeon by any means. It's actually the vast majority, I think, are not online bashing these treatments, but there are a few very vocal, very loud, very popular voices that are saying these things. And I really think, again, that they're doing people a disservice because they're steering them away. They're scaring them away from treatments that can really, really be helpful for them, especially if they're looking in the mirror, not liking what they're seeing. I've been there before, and they really don't want to do a facelift. Even if they can afford it, they don't want to do it, or they just can't afford it. So they're really steering people away from treatments that can be so helpful to them, and that is why I'm doing this video. So what are the plastic surgeons saying about these tightening devices? They are saying that these devices actually melt the fat underneath the skin, and that in so doing, they make you look older because you are more hollow and more saggy, etc., losing support underneath the skin, and it just actually makes you look older rather than younger and makes you more saggy rather than less saggy. So is that the truth? Can that happen? The answer is yes, it definitely can. However, as I mentioned in the last video, there's a lot of nuance here that is being missed when we are making blanket statements like, these procedures age you, they just make you look worse, and nobody should do them. Lots and lots of nuance here. And do the vast majority of people end up looking older than they are when they do these treatments? The answer is, of course, no. Then why would anybody do them, right? The nuance here lies in how the treatment is done, who is doing it, and who it's being done on. If someone is really a good candidate for it, and if it's in the right hands, someone who's well trained, who knows how to not overdo it, how to not go too deep and get into that fat where they're actually, yes, maybe melting a bit of fat and causing a bit more drooping, we don't want that. And I can tell you that in treating people with these devices for years now, that has really never been the case for me and my patients. And I will say again that for the vast majority of people, that's not the case, and it actually helps them. Now, there is a separate issue of how effective are these devices. Are they as effective as a facelift? Are they going to give you a facelift-like effect? And the answer is typically no. And that makes sense, right? It's not surgery, and you're not doing surgery for a reason. Maybe you don't need surgery. You're not advanced enough to need surgery. Or maybe you just don't want to do it, and you're okay getting a mild benefit from a treatment like radiofrequency or ultrasound-based devices. You just have to go into it knowing what to expect. So appropriate expectations are really important, and that's something that the person who's treating you should be talking to you about. And I make it a point always when I talk to patients about these treatments to tell them it is not going to be like getting a facelift, and that really at best they're going to get a mild to moderate improvement. Now, that might not sound great, especially when you are investing typically thousands of dollars. Usually, for example, in the US, in a major city, for an ultrasound-based device like an alt therapy or a soft wave, you're probably going to be paying a few $1,000s for a full face treatment, or for a lower face, upper neck, something like that. And then for the radio frequency based devices, it varies a lot. But again, for something like Thermage, it's again a few $1,000s, or even the radio frequency microneedling, which is often less expensive but require more treatments, typically 3 to 4 treatments. And those even can add up after 3 or 4 treatments to be $3,000 to $4,000, right? So this is not a small investment, but again, for some people, actually for a lot of people, it is really worth it because of the degree that sagging actually affects our confidence, and in my view, actually makes us look older than we are. And I think a lot of people feel that when they look in the mirror. And again, I can tell you, I said it in the last couple of videos as well, I have been there myself. And when you see that sagging in the mirror, you almost would do anything to fix it. I mean, almost, right? Maybe not spend $100,000 on a facelift when you're 43, but yeah, you would really put in a lot of time and effort and money to fix it because it just is bugging you so much. And if you identify with that, then you are not alone, okay? So when we're dealing with sagging, here is what I would say. If you are dealing with mild to moderate sagging, which again is typically for someone in their 40s, early 40s, 50s, and maybe even up to early 60s, especially if you have lived a very healthy lifestyle, taken good care of your body inside and out, taken good care of your skin, had good skincare, avoided really excessive sun or protected yourself from sun, all those things in place, then yeah, even early 60s could count as well. If you have mild or moderate sagging, then a non-surgical treatment like a tightening device in combination with something to help restore volume, which we talked about in the last video as well, can actually help you get a noticeable improvement in the deep fold, in the jawline tightness and smoothness, and in the jowls. So you just, again, have to go in knowing what you're going to get. And when I say noticeable, again, I don't mean like a facelift, but I do mean at least a mild improvement. Typically, if you look at the studies for these treatments, like for example, for radiofrequency microneedling alone, without any filler or anything like that, on average, in the studies that we see, they get about a 20-25% improvement. Okay, so is that a 60-70% improvement like you would get a facelift? No, it's not. But again, it's not surgery. And then for the ultrasound-based devices, again, these vary as well. But for example, for the newer ones like SoftWave, if you look at those studies, on average, about a 30% improvement in sagging and deep folds and that kind of thing. So again, it's not surgery, and you have to go in knowing that it is not going to be 100% better. The sagging is not going to completely disappear, but depending on where you are and also what else you're doing to help your skin and to help with that sagging, again, whether it is restoring some volume that's been lost or leading a very healthy lifestyle, which is really helpful, having a really stellar skincare routine, all of those things together are really going to give you the best outcome and also help your results last longer. And so, yeah, the answer here really is you do not need surgery. If you're in your 40s and having a little bit of sagging, you don't have to deal with it. You don't have to put up with it for the next 10 years, 20 years until you're ready for a facelift or until you save up for a facelift. You really can address these things non-surgically, but you have to have proper expectations. And again, those expectations have to be explained to you by the person that's treating you. So that brings me again to the nuance when it comes to these treatments regarding who is actually treating you. So for example, if you get a Groupon, for example, for a SoftWave treatment, and it's $1,500 instead of $3,000, yay, amazing, that sounds great. So you go to this med spa and you're treated by a non-physician who has minimal training in skin and aging faces and the underlying structures and the layers of the skin, etc., and doesn't even have a dermatologist or a plastic surgeon on staff at that site. Oftentimes they want to get you a good result, so they're really going hard for it. They're really going aggressively because they want to get you a good result. It's not that they're malicious or want you to look worse, but not being proficient in the use of the device and in the underlying anatomy, then there's more potential for a bad outcome where you lose some of that fat and maybe actually, yes, feel a little bit more hollow or look a bit more hollow afterwards and just really don't look better, and if anything, look a little bit worse after. Again, I will say really this is the exception, and if you want to minimize the risk of that happening, then the best thing really to do is to go to someone in the core specialties that is using these treatments, like a dermatologist, like a plastic surgeon. A lot of them still do these treatments, by the way. Again, like I said, it's those few vocal, very loud voices that are talking about how they don't do these treatments and they really advise against them. But there are a lot of plastic surgeons that still do these treatments because they believe in it and they know that not everybody can do surgery or, is a good candidate. So in the last video, and I would really go back and watch that, I'll link to it again in this description for this video, but in there, I give you advice and tips on how to find a physician that you trust to do a good treatment on you and to have your best interests at heart and to be really well versed in what they're doing. So go ahead and watch that video. I'm not going to repeat all the tips again here, but I do think that it's worth your while to look into non-surgical options if you are someone with mild to moderate sagging and you're just really not ready for a facelift. If you want a facelift and are ready to go all in and just don't even want to deal with like the less invasive treatments and having to do maintenance and all those things, that's totally fine. These things do require maintenance, at least every year, and depending on where you are and where you want to go, sometimes a little bit more frequently, like every 6 months, but they do require maintenance. And a facelift still requires maintenance. It doesn't last forever. They last maybe like 10, 15 years, but at least it's less maintenance, right? So if that's for you and you just want to skip all the stuff, get the facelift, I'm all for that too, if that's what you want. But I do want you to know also that it is not your only option. That is really my main message here. Facelifts are not your only option. There is a subset of people, yes, where facelifts are really, really going to be your best option. And that is someone, again, if you're now in your 60s, 70s, etc., and you really have not done any maintenance treatments or preventative treatments before that, and you're coming in and you're wanting a significant improvement in the sagging and folds and all the things, then yeah, a facelift is probably going to be your best bet. And I'm very upfront about that, and I think that's the way it should be. So, we're not trying to veer people toward a treatment that we want to do on them. We want to veer them toward the treatments that are going to be best for them, right? So that is what I have to say about that. If you have any questions about any of that, please drop it in the comments. If you're not subscribing already, please subscribe. This is a new channel, and I would just love to have you. I love putting out content for you. I love answering your questions. And by the way, we are enrolling now for my program, Radiant by Design. This is a comprehensive, very personalized, tailored program where you tell me about you, your skin, your struggles, your lifestyle, your goals for your skin, and I come back to you with a completely comprehensive, personalized blueprint where you get your morning and evening routine. Very simple, straightforward, effective. My motto is maximum efficiency and efficacy, where I don't really mess around with like fluff products that, really aren't doing much for you but are very popular. And then you also get your recommendations for holistic skin health habits that are really going to help move the needle for you in terms of preserving that collagen, preserving that glow throughout the years, helping reduce or minimize the progression of the sagging as you are getting older, and other things like wrinkles and dullness and all the things, because a lot of our skin health starts within, and that shouldn't surprise anybody, right? Because our skin is an organ. It is our largest organ. It is connected to all our other systems, to all our other organs, and it is fed by the blood in our bloodstream. So of course our skin is affected by the things that are happening inside our body, and those are things that we actually, a lot of them, have control over, right? And then lastly, as part of the blueprint, you get your targeted treatment protocol, and that is basically a playbook on which professional treatments, whether it is neuromodulators like Botox, Dysport, etc., resurfacing lasers, tightening devices, microneedling, PRP, etc., all the things, whatever it is for your particular skin and your goals that are really going to benefit you, and also a timeline on how to do everything and when to do everything, risks and benefits, all the things. And so if that is of interest to you, we are closing down registration this week. And so I'll put the link in the description to sign up for that before it is too late, because you really get a major, major, major discount for joining right now. While it is a pilot program, the next round, it is going to be at least double the price. So you want to get in now before it's too late. All right, hope to see you in there. And again, this has been so much fun. And if you have any questions, drop them in the comments, or if there's anything else you want to hear about that you want me to make a video about, I'm happy to. And that is all for now. I hope you have a wonderful day, and I'll see you next time.